I mean, in general, in terms of wish list, obviously the biggest growth I want to see is actually at AFC Wimbledon. They still haven't had fans come into that ground. So stage one is getting the fans in, and stage two actually is, I think they're such a good club and work so hard in the community that they deserve to get better. So there is a clause in their agreement that means that the stadium can get bigger as well if they get to a higher level. And actually, who would resent them for that? In terms of other development, there's a big issue around health services in Merton, particularly across the east of the borough, in the poorer bits, in Mitcham in particular, but also in Morden. And so we need to do some work with the local health service and maybe with partners that they can find to enable them to bring in services and make them work at scale. But then beyond that, it's probably the same as most places in London. What we've got a real shortage of that we need is housing. There's a real undersupply of decent quality homes for people. We don't have a particularly big housing waiting list. We have probably the lowest number of people in temporary accommodation, but even with the lowest number of people in temporary accommodation, you see people all the time who are short of good housing, or are overcrowded, or living in damp conditions with terrible landlords. And by getting a better supply of new homes, we can help to do something about that. And with new homes for people who really, really need it, come new homes for people who are looking to get onto the housing ladder, for more established families who want to move up the ladder, or even some who want to downsize, and more space for businesses and just more general economic activity, which benefits the borough as well. So that's what I would. That's it's very broad, but it's a wish list: more homes, more decent homes, and then those people can go and watch AFC when they're in the Premiership.
Could you unpack the issue about the health services a little bit? What's the problem there?
Well, there's a number of things. I mean, first of all, we've got a concern at the moment. The government have been consulting about reconfiguring health services, hospital services, and that would mean that we don't have any local hospitals actually, or any general hospitals inside Merton, but we have 2 or 3 just on the edge, just across the boundary, and one of those, St Helier, has now been has been penciled in to have its A&E, maternity services and various other services taken away and plonked down south of Sutton in Belmont, which is really inaccessible for a lot of our residents. And obviously we're fighting against that. We were thinking about what we need to do to stop that from happening. But irrespective of that, there's been a lot of concern for a long time that primary healthcare services and maybe like the cottage hospital type of arrangement, there just aren't those things for people living in Merton, particularly in the east of Merton, in the poorer bits. In the wealthier bits of Merton, the NHS has opened a big new practice at the Nelson, which is in Merton Park Ward, which is one of the richest in the borough. And we've always had this concern that why are you building things where it's sort of least needed, but nothing has come in its place elsewhere. So a number of years ago, one of Mitcham's hospitals, the Wilson, was closed down. It's for such a long time being penciled in to be reopened or for health services to be brought back there, and it never has. So we need to work with the NHS to make sure that they can do something to bring those health services there. And we'll have an open mind. If they've got ideas about how to do that in partnership with development or whatever, then we've absolutely got an open mind, but they need to bring in services where they're most needed. Otherwise, health inequalities are going to grow.
I was going to ask you whether there's something in there that you can do with 106 or working with developers on schemes elsewhere that you can leverage some of the value that you do have in Merton to help fund some expansion of the healthcare service. And forgive me for my naivety and not knowing how all of those strings connect.
Who knows? There might be, but I mean, to be honest, that's going to be a marginal part of it. The key part of it is, is the NHS committed to improving health in the areas of our borough that need health services the most. But yeah, when we've got several thousand people who are on the housing waiting list.
Yeah.
We want to sort of like knock a chunk into that if we can. But the problem that we have really in Merton as a borough is sites. We don't have like other boroughs do, of maybe having 2 or 3 very big like brownfield developments that are that were industrial space that are now going to not be. We don't have like what was the Olympic Park or something like that we can focus all of our energies on. We're very much a sort of like, there's a bit here, there's a bit there, and trying to sort of like cobble it all together. And also working with housing associations, and our stock was transferred more than 10 years ago, so we're working with Cllr, who are currently the providers of what used to be the council's housing supply, which unfortunately we don't have control of anymore. Yeah, so we work with them to try and get regeneration going on those bigger sites. But it will be, if we're to achieve this, it will be lots of different sites and a few bigger ones like Morden Town Centre. We're looking to bring more. We're trying to assemble the land there around the tube station, work with TfL and other landowners. That might provide a couple of thousand new homes, and that's a real opportunity for people in the future. Other similar situations at some point, Wimbledon Town Centre, we've got a Wimbledon master plan that's being worked on. That's an opportunity as well.